Hi, my name is Atif Kamal, and this is episode 29 of Be Logical. This one pertains to an article written by John Tozzi. He writes for Bloomberg's Businessweek. The name of the article is Lights, Camera, Scalpel. Should Surgeries Be Recorded? Dr. Marty Makary, who is a surgeon in Baltimore's Johns Hopkins Hospital, believes that they should. He argues both for the security, but more so the educational purposes of video surveillance during a surgery. He gives an analogy for security. The analogy he gives is in retail, where if a retail associate knows that they're being recorded, they're less likely to act in violation of the guidelines that their company sets. So, for example, a retail associate would be less likely to steal jewelry or like underwear, or shirts, socks, and so on if they know that they're being recorded. I don't have any data on this, and he doesn't present any either, but it sounds like we're both assuming that to be the case. The examples he gives within medical centers are as follows. He gives a 2010 Indiana University study where gastroenterologists spend 49% more time inspecting patients' colons when they know that they're under surveillance. And in a 2010 North Shore University Hospital study, 82% of workers followed hand-washing guidelines while they know they're being recorded, whereas only 7% would follow such guidelines when they did not know they're being recorded. Now, in terms of the educational purposes, he compares it to baseball, where baseball players watch videos of games to improve their skills. In the case of surgery, surgeons in training, or maybe even just professional surgeons, view videos to improve their surgical techniques. And I could vouch for that myself, actually, not in terms of surgery, but in terms of when I was studying education. I would watch videos that I would have recorded, and of course I'd get the parents' consent. I'd watch those videos to figure out like what went wrong with the lesson and how to improve on it in the future. And further, if I was able to have lessons where I could view veteran teachers in terms of how they manage a class, then I would definitely see value in that. And I think surgeons in training would also see value in viewing expert surgeons on video. Now, Dr. Marty Makary was asked whether he records any of his own surgeries. His response was, "I haven't been commenting on my own procedures." Personally, I find that response kind of fishy because it's not a straight yes or no answer. Yes, I do record my own surgeries, or no, I don't. Because he doesn't give a straight answer, it leads me to suspect that he does not record his own surgeries. And that further leads me to suspect that even though he makes this argument more so because he's interested in the educational purposes, he also can't help being worried about the negative consequences. That is my personal speculation. And my personal view is that if you're following protocols, then there shouldn't be any worry. At the same time, I could think of the worst case scenario where let's say somebody's out to get you in the surgical center or medical center that you work at, so they try to use video to like threaten you or to get you fired. So that's a possibility. I don't know how often that happens. So I tried to come up with a couple examples on my own for when I think video surveillance might have come in handy in a surgical center. This first example I'm getting from NorthJersey.com, which is a website for a Jersey newspaper. The name of the article is OSHA cites serious violations at surgical center. Company says it is contesting findings. It was written by Richard Newman, and OSHA, OSHA, stands for Occupational Safety and Health Administration. Now, CTO Management LLC owns a hospital, and in March of 2013 they were charged $68,000 in penalties, and it was because an employee had stuck their hand with a needle and that employee's blood was not tested in a timely fashion. Now, an idea I get for this particular example of how a video surveillance might have come in handy is that you could pinpoint exactly at what time the employee got stuck with the needle and how long it took for that employee to have their blood tested. So it doesn't pertain directly to surgery, but it happened in a surgical center. And that's an example of when I think video surveillance in a surgical room would have come in handy. Another example in terms of educational purposes comes from Neighbors Go, which is a Dallas Morning News affiliate. And the name of the article is Parkland Knee Surgery Done by Doctor Leads to Amputation Questions. It was written by Brooks Egerton. Now, in 2008, a female patient comes in and she has arthritis in her knee, so she needs surgery. But she only needed the pain to be alleviated. Instead, what happened, because of a mistake by a resident trainee, instead her leg was amputated, her leg was replaced. So now we wouldn't want this mistake to go to waste. This is something that maybe some surgeons in training would also want to view so they could not make the same mistake. And at the same time, you're not gonna be able to look at every single video of a mistake when you're a surgeon in training. That's my guess. I don't think you have time to view all those videos, but it's nice just to have all that data available. So depending on which particular type of surgery a training surgeon is going into, they can just view the videos that are relevant to them. And that's how I think video surveillance of actual surgeries happening would be handy. And that's it for this episode. Thank you.